Thank you very much for coming to this webinar. I'm Snehal Pinto-Pereira from UCL, and we have a very exciting program of little talk to tell you about the study and where we are now and what we've learned with the data you've so generously given to us. We'll tell you a little bit about where CLoCK has featured in publications and maybe in the media that you might have seen in the news. We'll tell you about some of the children and young people that are involved in designing and setting up the CLoCK study. And importantly, we'll also be answering the questions that you'll have asked us. So some of you will have already sent questions via email, and we'll be answering those. And also, if at the bottom of your screen, there'll be a two-box bubble called Q&A. If you type your questions in there during the webinar, if you have any questions, we'll be monitoring that as well, and we'll be answering those questions. So before we begin, I think it'll be nice for all the panelists to introduce themselves and tell us a little bit about how they're involved in the CLoCK study. So I'm just going to go through the panelists that have come up on my screen here, and they can just introduce themselves. So Terence, do you want to kick off?
Thanks, Snehal, for that introduction. Yeah, my name's Taryn Stevenson. I'm a professor of child health at University College London. So I research children's health issues. I teach students about children's health issues. And I am also a practicing doctor. I see people under 18 NHS patients in London. And I'm very excited. I'm glad we're holding this today. I'm very excited to be talking to you about the research we've been doing on long COVID in young people across the whole of England. I'll pass on back to you, Snehal. Thank you.
Thanks. Thank you. Michael, do you want to introduce yourself?
Hello, everyone. I'm Michael Lattimore, and I'm the project manager for the CLoCK study. I'm based with UKHSA, which is United Kingdom Health Security Agency. We were previously Public Health England. And the contact I'm generally having with all of you is when you're sending in your emails into our inbox, you're likely to get a reply from Michael, and I am that Michael. Thanks, Snehal.
Thank you, Michael. Roz?
Hi, everyone. I'm Roz Shafran, and I'm a professor of psychology, and I'm a clinical psychologist, and I try and help with young people's mental health. And with Terence, also just very excited to understand the mental health as well as the physical health consequences of contracting long COVID.
And finally, Emma.
Thanks, Snehal. Hi, I'm Emma Dalrymple. I am the PPI lead for the project, which stands for Patient and Public Involvement. And basically that means that I'm really interested in making sure that young people's opinions and experiences are heard and included within the project.
Thank you, Emma. And like I said, I'm Snehal Pinto-Pereira. I'm a lecturer in population health and applied statistics at University College London. And so all the questionnaires that you'll fill in and send in, I get to play with the data and analyze them. And yeah, thank you for making my job interesting and fun. So let's kick off with Roz giving a little recap of the study and tell us where we are right now and what we've learned.
Okay, so I think one of the first things and most common questions that come into Michael is, what about the vouchers? And I'm really, really pleased to say that we have been able to change how we were going to give vouchers to thank you as you go along for taking part in the study. And just this morning, the vouchers have started to go out, but it's going to take 14 hours to send all of the vouchers to everybody because it's such a large study. But hopefully you will be getting your voucher for taking part within the next day or so. So that's it's not hopefully why most of you are taking part. It's also for understanding the science and helping understand long COVID, but it is nice for us to be able to thank you for your time. So you should be getting your vouchers very soon. So why did we do this study? Well, as you know, between a particular period of time when COVID was around, COVID-19, we realized that there are huge numbers of children and young people who are testing positive for COVID-19 in England, and many, many others who are also having tests and testing negative. So we wanted to understand what happens to children and young people when they test positive for COVID-19 but also what happens to children and young people who have gone for a test and test negative, because we want to understand what the impact is of becoming infected with COVID-19. So we needed to have what's called a control group so that we would match children and young people, so they're the same age, same gender, live in roughly the same area, and we could really just see what was the impact of testing positive for COVID-19 and comparing them to a group that tested negative. So if we want to know what the long-term implications are, we thought, how are we going to answer this question? And we decided we would team up with Public Health England, now the UK Health Security Agency, UCL, the Great Ormond Street Institute of Child Health, and many, many other clinical doctors, researchers, people that understand statistics, all together to try and answer the question about what happens to children and young people after they have COVID. And the reason that we wanted this matching is because we wanted to make sure that we understood the whole picture, including children and young people that may have tested negative, but will have still experienced the pandemic. Because as we all know, there were lots of messages, lots of impacts on children and young people about staying at home, about not going to school, about not seeing friends. And we think that that's particularly difficult on children and young people at a time when actually friendships and relationships are very, very important. So as you will hopefully know, you've got an invitation by letter to take part in our survey. And we said that we would give you a questionnaire and we would ask you to complete it, and that we said you can ask family members for help and that you can pause it as you go along. But we would send you these questionnaires over time so that we can understand what happens to symptoms over a period of 2 years. Another really common question that Michael gets is, well, when is my next one due? And it's actually pretty complicated, and it depends a little bit. So this is a very complicated slide just showing you that actually when you get your questionnaire depends really on when you had your test. So if you tested in September 2020, you would only been able to have got a questionnaire at 1 and 2 years. But if you tested in January 2021, then we started the study in time that we could give you some more questionnaires, including sort of 3 months after you first had COVID, or tested for COVID, I should say. And Michael's put this together so that you can see when your ID, what your ID begins with, S for September, O for October, N for November, and so on. That will tell us the time of the test, that will tell you when you're invited, and that will tell you when your next surveys are due. So you should hopefully recognize some of those IDs and recognize that you've filled out some questionnaires already, and you'll be getting your 1-year survey and 2-year surveys 1 year and 2 years after you had your test. So I want to just tell you some results. Well, we found that at the time of testing, about 1/3 of young people who tested positive had symptoms, compared to only 8% of those who tested negative. So the kind of idea that children and young people may not have symptoms at time of testing, we found that that was the case. And the kind of symptoms that children and young people have, if you were positive, there was loss of taste of smell, not in everyone, so only in about 1 in 5, headache in about 1 in 4, being tired and having a sore throat. And the common symptoms when you were negative were also sore throat, headache, but also cough and fever, not so much the loss of taste and smell. And then what did you tell us about 3 months after the test? Well, the questionnaire was completed by 13% of the people we sent it to. That made it almost 7,000 children and young people aged 11 to 17. And as you can see, really surprisingly, the numbers of children and young people who had symptoms 3 months after the test were higher than actually at the time of test by quite a lot. And that was true for the positives as well as the negatives. And that, as you see, that some people just had 1 symptom, and about 1/3 of the positives had 3 or more symptoms, and 15% of the negatives having 3 or more symptoms. And some people having 5 or more symptoms, lots and lots of symptoms in the positives, about 13% and about 6% who had 5 or more symptoms in the negatives. And what were these symptoms? Unusual tiredness was very common, shortness of breath, very common, headache, loss of smell and taste, and dizziness were all very common. And what we're trying to do is to really understand the impact both of testing positive, but also the pandemic, and looking to see, well, actually, teenagers can be tired at times. And we know that a third of 11 to 15-year-olds in 2007, so way before the pandemic, reported fatigue. And that even before that, you had a lot of adolescents who have at least one headache or fatigue or asthma. So we really want to understand the impact of the pandemic and the impact of testing positive, and trying to understand what's been going on since COVID came about. What we do know as well when we're looking at mental health is that referrals to children and young people's mental health services are really going up, and they're on the rise. And you can see that's a graph that had quite a lot of publicity from the BBC. But the picture of the identical twins is really supposed to represent that we didn't find a difference in the mental health symptoms between those that tested positive and those that tested negative. Again, speaking to the impact, perhaps, of living through the pandemic. Why is the study important? Well, that on the left, that is the largest stuffed teddy bear that the world has ever seen. So that's the Guinness World Record for the largest teddy bear. And we are actually the largest study of its type in the world, in which we've matched children and young people in a national cohort study in this way. So it's really important because it means that we can be more confident in our findings. And that's important. And it's important to understand what happens in long COVID over time, because we want to be able to help people who have got long COVID. And we want to know about the sorts of services that people need and want in order to make a recovery. So we are really, really grateful for your help so far. We would really like you to complete your questionnaires at 1 year and 2 years, so that we can properly understand what happens to COVID over time for those that tested positive, those that tested negative. And we are showing our appreciation with the vouchers, but we are really very, very grateful for your help so far. So please do stay with us. We'll do more of these webinars to help keep you up to date. Get a website that should go live soon. You should be getting certificates and newsletters so that you can keep up to date with how the studies and the questionnaires that you're completing are really making a difference. And that's it. Thank you.
Just to reiterate, yeah, what Roz said, that we are extremely grateful for you guys taking part in the study. It is amazing.
So I would like to echo what Roz has said, is that everything that's in this webinar is thanks entirely to you, the people who participated. And why has there been such interest in this around the world? We'll show you a bit about some of the media activity we've been doing. It's been fascinating for people around the world because this is a new disease. It's a new virus, and long COVID is a new complication of that virus. Now, I've been teaching, I said earlier, I teach students and train doctors. I've been doing that for 35 years. This is the first time in my life where I'm not teaching people or talking about something that there's a textbook and I can look it up, or there's an expert I can turn to somewhere in the UK or in the world. This is all new. And what you're helping us do is understand more about this virus called SARS-CoV-2 or coronavirus, and more about this problem of persisting symptoms after you've initially had the infection, remaining unwell for a long time, called long COVID. And as Roz said, two big things. One is this is the biggest study of its type in the world. And the fact we have half of you tested negative, you're every bit as important as those who tested positive, because one of the very powerful things about this CLoCK research has been our ability to compare young people who've had the infection with those who haven't. And I think that's partly what's generated so much interest around the world. So we're going to start with we also have developed a research definition of long COVID, not a definition to decide whether you should be treated or seen by a doctor. It's a research definition to allow us to compare research from one country with another. And Patrick's going to play you a little clip from the Today program on February the 7th.
Coming up to 10 to 9 now. What exactly is long COVID? We hear the phrase used all the time, but over 200 symptoms have been associated with it. Now, a new research definition of long COVID has been established, and we'll talk to the man who's done it in just a moment. First, though, let's hear from Fionn Barnett, who was 22 when she caught the virus.
So I basically had COVID in August. I'm still dealing with the after effects 6 months down the line. Long COVID started about a month after I come out of hospital. Basically, I'm just left with brain fog now, which obviously hinders my university. I forget what I'm saying halfway through sentences. Hair loss through all the trauma of it all. And fatigue is one of the main ones as well. Like psychologically wise, I'm seeing a counsellor, but physically wise, physical, I don't think much can be done because it's so new.
Listening to that, Professor Sir Taryn Stevenson from University College London's Great Ormond Street Institute of Child Health, who's been working on that definition. Morning to you.
Good morning, Nick.
Can I start with a question which may infuriate people who are suffering from it and those who know them well, but it is asked sometimes. We are sure there is something called long COVID, are we? Because some people suggest it's in people's heads.
No, we are certain there is something called long COVID, sometimes called post-COVID-19 syndrome, and various other names in the United States, long haulers, but there are definitely a group of both adults and children who have persisting problems a long time after the acute viral infection.
So you wanted to go a stage beyond persisting problems after the virus by coming up with some sort of definition. How did you go about that?
Absolutely, Nick. So this is a completely new disease. There are no textbooks. There's nothing you can look up. And one of the problems with new diseases is if people are all describing different things. So we wanted a research definition that could be used across the world to compare different studies. In the past, that would have been done by a group of people, small number of people, probably largely like myself, older white man, sitting around a table and just arbitrarily coming up with a definition. What we did was we got over 120 people, mixture of parents, carers, young people, doctors, nurses, researchers, and we used data from our research, 6,800 teenagers who told us what they were experiencing. And putting that together, we online asked them to rate or score different things and went through a process called a Delphi process and came up with the definition that we're publishing today.
So, in other words, this is, as it were, sort of patient-led, sufferer-led definition of long COVID.
Very much. They've contributed hugely, and that, I think, is important, that gives ownership. It's not somebody like me saying this is long COVID. And indeed, in asking the teenagers, unlike much research, we didn't ask them to say, have you got long COVID or not? We asked them, what are you experiencing? Headache, fatigue, loss of smell, ongoing shortness of breath. And so we've had the descriptions from 6,800 teenagers, which is, to our knowledge, the biggest matched control study in the world. Half of those had tested negative and half positive. So we were able to compare the two groups to try and tease out what was long COVID and what was just the consequence of living through a long pandemic with closure of schools, exams ceasing, being forced to live at home with your parents, which isn't what normal teenagers want to do.
So to be clear, that sort of control group, if you like, was the way in which if someone says, well, hold on, you might have had a headache anyway, teenager trapped in the house for a very long time and so on, you're saying the control group allowed you to isolate out what is almost certainly linked to the virus and what not.
Absolutely, Nick. That is the real strength of that kind of study is you have a group of people who've lived through a long pandemic, but never, and we can trace them, we have a database, never had SARS-CoV-2. And that allows us to distinguish the two, as you point out.
No, I hesitate to do this because it might be a long answer, but you tell me the definition that you've now come up with is?
Yeah, no, it's not a very long answer. It's a child or young person, that's somebody under 18, who has persisting problems, having had a positive test for COVID-19, and I'll come back to that briefly, who has ongoing problems that impact their physical, mental, or social well-being. It's interfering with some aspect of daily living, school, work, home, or relationships, and has persisted for 12 weeks since testing. And the one thing I want to emphasize, because I know the carers and young people who helped us, this is a research definition, not a clinical definition. If a young person has a problem, the decision whether to refer or treat them should be a shared decision between young person, their carer, and their doctor or nurse or clinician. This is a research definition to allow us to compare research, and that's why we put in having to have a positive test.
Understood.
Because otherwise you don't really know whether people have had SARS-CoV-2 or not. But at the beginning of the pandemic, testing was not widely available, and many young people and adults may have had SARS-CoV-2 and not have a test to prove it. So to be clear, this is a research definition, not something that should be used to decide on treatment.
Professor Sir Taryn Stevenson of Great Ormond Street Institute of Child Health, thank you.
It's coming up to 5 minutes to 9.
Thanks, Patrick, for playing that. So I hope that gives everyone on the webinar an idea of probably not a program, I don't know, that lots of teenagers listen to, but it's listened to very, very widely by adults in the UK, by people involved in certainly policymakers, politicians, civil servants, leaders of health services. And the fact that the Today program wanted to know about the CLoCK study and our definition, I think should say to you how crucially important it was that we had your data from you. In that instance, the first 6,800 who'd we've recruited from January through to March 2021, but we've now got over 30,000 people involved, young people, and it's vital. Your contribution and your data has been of interest around the world. So we've done presentations to people in the Netherlands, in Germany, in the United States, multiple times in England. Also, we're going to be doing one in Moscow, one in Barcelona, one in Riga, in Latvia. So people all over the world are benefiting from the information that you've given us. And I think that's the important message I'd like to get across. Okay, I'm going to go on mute and go back to Snehal or Roz, I think, to carry on.
Yeah, thank you, Terence. Thank you for that. And yes, we will take on board the feedback from the poll about you guys not having heard about CLoCK in the media and work on that. I'm just going to hand over to Emma for a little presentation.
As I introduced myself, I'm the PPI lead. So it stands for Patient and Public Involvement, which is quite the mouthful. So it just gets shortened to PPI. And PPI should be a really massively important part of any research project, really, because the idea is that it helps researchers work with the people taking part in their research or who are impacted by their research, rather than just doing it about them or to them. So basically, good PPI should be making sure that professionals are doing things with the people taking part and not doing things to them. So PPI in CLoCK is really interesting, and I would say that because I'm biased, but it's also really unique because CLoCK is such a big, huge study. It's enormous, like it's the biggest in the world, is the first reason. And secondly, it's unique, it's brand new. We don't really know very much about long COVID. So from a PPI point of view, a good group size for discussions and chats is about 6 to 8 people. But obviously, when there's tens of thousands of people taking part in a study, the challenge we wanted to address is to make sure that our PPI group was representative of all of you guys taking part in the study. So the way we went about it is that we invited people who'd completed the CLoCK questionnaire, and we worked really hard to make sure we included young people from all over the country, from across the whole age range of the CLoCK study. We made sure we invited young people both with and without ongoing conditions and existing disabilities. We had a mix of test positive and test negative young people to match the control group. And basically, we wanted a really broad range of backgrounds, of cultures, of experiences to try and make sure that we best reflected the diversity amongst all of you and the thousands. What we do is we meet online for an hour, and we do that about every 3 months. And at the end of each session, participants receive a voucher to say thank you for their input, their contributions and their time, because we think that is really important too. What we do is quite varied. It's, I'd say overall, something that's very important to the researchers and to everyone in the CLoCK study team is listening to the opinions and the experiences of young people themselves. And certainly in the PPI group, all of the questions and all of the things we ask are asked directly to young people. We'd want to know things like, how's the study going? Is the information that we're sharing relevant, necessary, useful? We want to know if there's anything we're missing, if there's anything we could be doing better. And we asked for help for things like presenting and sharing information and the findings of the study. We want to make sure that it's clear, that it's easy to understand, that it's relevant, that it's engaging. Something we did recently, Terence was just speaking about the Delphi study. We made sure that the definitions, the statements to define long COVID, we shared them with the PPI group to make sure that young people were also in agreement, and to find out if they weren't in agreement with anything and to really check that out, because we felt that was very important. Something else you might have noticed is the lovely artwork, and that came about, one of our participants, Sky, designed that because we were asking for feedback on a logo, and she decided to create her own, which is rather lovely. So that's a summary of some of the things that we have been doing generally and specifically. Before I stop, I have a final request. So we are working alongside an organisation called Long COVID Kids, and they have helpfully suggested that we might like to invite some more young people, a few young people with long COVID, to come and take part in the PPI group. So if you are a young person with long COVID and you would like to take part, or you're interested in taking part in the PPI, my email address is on the bottom of the slide, and I'll put it into the Q&A section as well. And please feel free to get in touch. And also, if you have any questions about PPI generally, then get in touch. Thank you.
So now we're going to start answering the questions that you'll have sent, both via email and that you'll have dropped in the chat box. So thank you very much for that. We're trying to answer some of them by written responses, and we'll answer a couple of them verbally now as well. So if I just start off with some of the questions that we got via email. So the first question is, I got COVID in October last year and have not fully recovered and have iron and vitamin B12 anemia, fatigue, shortness of breath, lack of taste and smell, confusion, and a few others. The question I have is, is it normal to get a sense of smell from things that aren't around that no one else can smell? Is an ulcerated mouth a symptom of long COVID? How long will long COVID last? And is there any long COVID programs that can help with these symptoms, like tests and medications? Roz, would you like to take that question?
So I think there are lots of things within that. I guess one of the things we should probably say is that in terms of if you've got individual queries about your own health, it's important to go to your GP, and that there are services for children and young people. There are some specialist services if your GP thinks that would be helpful for you. But the first port of call is your GP and asking your GP. I think the reason we're doing the study is that we just don't know about a lot of different things that people have and what's related to what. But certainly we do know that there are reports of children, young people and adults whose sense of smell has changed, and so they can smell things. It's not a complete loss, it's a change. So I think there are lots of different components for that. I think for your own health, go to your GP, but we are interested in those symptoms. That's why we're doing the study. So if you can report those under any other symptoms, then hopefully we'll be able to answer your questions later down the line.
So the next question that came through, which kind of also echoes some of the questions that are coming through on the chat, is why doesn't our GP take long COVID seriously, and how can we get them to understand my child's symptoms? Unrelated, can facial flushing and mood swings, anxiety be part of long COVID? Would either Terence or Roz want to take that one?
In answer to one of the questions on the chat line, what do we hope to get out of this? Our main goal is to use your information to share with doctors and health services and nurses and psychologists around the world to do exactly what you suggest, which is to help people understand that this really does exist. It's complicated. For different young people, it's different. But to try and overcome what one might call the skepticism that it doesn't exist. And I've heard from other countries, for example, I've particularly heard that doctors in Austria are very skeptical about long COVID. So we're hoping by using your data to try and influence people all over the world, including England, that this is a real issue and that people like yourselves need help with your problems. Facial flushing, I haven't heard of, but we do know that over 200 different symptoms. By symptoms, it's what doctors mean is something a person or a patient tells you is a symptom, something that they're complaining about, like a runny nose or a high temperature or sore ear. Those are all symptoms. And about 200 different symptoms have been described. I haven't read all of them. Facial flushing may be in there. It's not one that I recall. It's not a common one, that's for sure. But the fact that 200 have been described just shows how variable it can be. The dominant ones that we found from you that Ros presented were fatigue, shortness of breath, headache, cough, dizziness was quite common, loss of sense of smell and taste, of course. And although we didn't find any difference in mental health scores or well-being scores between test positive and test negative, for sure, anxiety and mood swings could be a feature. When we wrote up our results, we acknowledged that people with physical health problems, a young person with cancer or leukemia can affect their mental health, and young people with mental health problems can have physical symptoms. So we see the two as being closely bound up. So for sure, that's possibly related to your previous COVID infection.
Thank you, Terence. So this question we got via email. So it's about, it's obviously from a parent. So our daughter tested positive for COVID in October 2021. Following government guidelines, they did not carry any testing for 90 days. After 90 days, we resumed regular testing via lateral flow tests. Our daughter tested positive on the first lateral flow test we carried out after the 90-day period. A following PCR test was negative. A second PCR test was carried out following another positive lateral flow test and was also negative. This then enabled her to have a first vaccine. Since then, our daughter continues to test positive on the lateral flow test, which was taken twice weekly, but has no symptoms of COVID and continues to be fit and healthy. What could be the reason for our daughter continually testing positive on lateral flow tests? Terence, do you want to take that one?
Yes, the quick answer is I'm not sure, but I put in the chat, fizzy drinks or acidic drinks can make lateral flow tests turn positive. It could be a faulty batch. If all the testing kit you got at one time and you're working through them, if you've used different kits obtained at different times, that's less likely. I think taking the swab too soon after eating can also cause these are called false positives. If you are getting a positive test and you're not got the virus, that's a false positive. Of course, as Ros showed, and other people have shown around the world, about 2/3 of young people who have actually got the virus in their nose and throat don't have any symptoms at all. So although you say she's got no symptoms and continues to be fit and healthy, that was true for 2/3 of our people who tested positive. So it's possible, I guess, that she's had several different variants, perhaps the Alpha, then the Delta. There was a Beta variant, now maybe Omicron. I don't know. Those are all possibilities, but it's lovely to hear that she is well. That's good news. And that she's had her first vaccine, which is also very good news. We're very keen on young people being vaccinated, but we'll protect them against what is an unpleasant illness, and as we're talking about today, can lead to long COVID illness going on for many months.
Thank you, Terence. Actually, because you touched on the point about the different variants, this is a nice question to follow up from that. Where did it go? Oh, yes. So my son contracted COVID in November, and less than 3 months later, he caught it again. There seems to be a different, milder strain, Omicron, but he still had physical health issues from the November illness. Are there any studies into the likelihood of the Delta leaving more people with long COVID than the Omicron does? And how about any findings regarding the effect of children having both Delta variant and then being reinfected with the Omicron variant, and whether that exacerbates the long COVID from the previous infection? I don't know, Ros, would you like to comment on that?
Sure. Such good questions, and really good questions and comments in the chat about the negative group and making sure, I think there's one of the questions saying, don't imply that just because you tested negative doesn't mean that you haven't had the virus. So it's about sort of research design, really. It's a really important question. And so we have used the opportunity to answer the question by having a smaller study, much smaller study that's starting now. It was Michael's idea, actually. So it's to look at Omicron, and we've got 3 groups in this: children and young people that test positive, children and young people that have tested negative and have never tested positive at all, and a group who tested positive for a previous variant and are testing positive again, so that we're certain. And we're going to be able to answer that question, though we can't answer that question now. But the point is well taken. Just as Taryn said, you can get false positives, you can get false negatives. And we were also aware that at the beginning, not everybody had access to tests. So it's another reason that we need lots and lots of people, so that we can really make sure our groups are as pure as they possibly can be. And if you are tested negative, let's say at the beginning, but subsequently you've tested positive, then SNIHAL is the one who goes through your spreadsheet and sort of puts you in the right group. So we can't answer that question now, but we agree with you that it's really, really important. And we also agree with the comments in the chat about being wary about our different groups and looking to make sure that we understand who's in which group.
And also, just to add on to that, Roz, we do ask about the question, if you have tested negative, do you still believe that you've had COVID? And we are going to look at that data as well. So we are aware, and we will address it, yes. Okay, so the next question is, what are the long COVID symptoms for people around my age? Oh, I can answer that, if that's okay. So yes, for children and young people, the most common symptoms of long COVID are things like tiredness, short of breath, headache, loss of smell and taste, and dizziness. And what we've noticed in the data that you've provided us is that as your age increases, the prevalence of those symptoms, the number of children who say they have those symptoms increase as well. I hope I answered your question. Okay, so we have another question. So this one is about, we have completed both questionnaires and they seem to be based very much around mental health. Is this how future surveys will be? We had hoped that it would be based around long-term symptoms, not just mental health. My son would like to ask about loss of taste. He tested positive for COVID in November 2020, completely lost smell and taste. His smell is fully recovered, but there are some foods that he still can't taste, like chicken, orange juice, and shreddies. Is this normal after so long, and what have other people experienced? Roz, would you like to answer that one?
In terms of, just reinforce what Taryn said, that we see mental and physical health as going together, and that there are some questions, quite a lot of questions on mental health, but we've also got quite a lot of symptoms, physical health symptoms, which are a checklist that people report, and we ask questions about physical health. So hopefully we've tried to get a balance, and for some people they'll think maybe there's too much on mental health, and for some people they'll say, well, perhaps you haven't covered my symptoms, but hopefully overall we didn't want to make the questionnaire too long. So tempted though we were to ask about the 200 symptoms that Terence has identified, we couldn't ask about everything. So this is kind of the best that we could do. But we want this, the reason the surveys are similar over time is because we want to track those symptoms. So we honestly don't know about what will happen to your son's sense of taste and smell over 6 months, 12 months, 2 years. But the information you're giving us, we should be able to answer that for people going forward when they have COVID. So we can't answer it yet, but you're going to help us answer it. So thank you.
So here's another question. Do you think that young people caught the virus more in the later half of the year than the beginning? Terence, do you want to answer that one?
We've been talking about variants. The pandemic started with the Alpha variant, and most of the results all the results we've been telling you about today really reflect the Alpha variant, because they come from young people who tested positive between January and March 2021. And then Roz said that we're now recruiting from January 2022, what we're calling an Omicron cohort, to see if it behaves differently, if young people are more likely to get long COVID or less likely, or just the same. The answer to the question, I think, is that once vaccines became available, they were introduced, I think rightly, first of all, for the most vulnerable people. For the elderly, we know that perhaps 150,000 people have died in the UK during this pandemic. Fortunately, the number of young people who've died, people under 18, is in the hundreds. So they were first introduced for older people and people with underlying conditions like diabetes that made them vulnerable. And then gradually, particularly as reassuring results have come through from all over the world, the age has gone down, 40-year-olds, 30-year-olds, 20, and now we're vaccinating. We started with people aged under 18, now we're down to 12 to 15. Now we're vaccinating vulnerable young children at primary school who are themselves at risk. So I think that's a long way of saying that initially young people were very open to getting infected because they were the last people to be vaccinated. So and infection rates were high. And then as we vaccinate more and more of the population, we would expect with the passage of time, fewer and fewer younger people to be infected, unless we get a new variant that the vaccines don't work against. But all of the variants we've had so far, the vaccines seem to protect against death and serious disease, even if they don't stop you getting a mild infection. So that's another reason why vaccines are very good news.
There have been a few questions in the chat as well about, will we be looking at vaccination data in the cohorts in the data that you'll have sent through to us? And the answer is yes, because one of the questions we asked you is about whether you got your vaccine or not. And so we're going to take that into account in subsequent work that we're going to do. So yes, thank you very much for answering that question as well in your questionnaire. Okay, so here's another question, which is a four-parter. So the first one is long COVID the reason I'm getting repeated chest infections and tonsillitis? Is there any evidence that my asthma will improve? Because I had asthma before, I've had asthma since COVID. Has long COVID weakened my immune system? And when I turn 18 in March 2022, will I be sent to a long COVID clinic? Terence, do you want to take that question?
So there's several bits there. Asthma is about 1 in 10 young people do get asthma. Not all of them have it lifelong. Certainly for very young children, children who wheeze before primary school, only about a third of them will still be wheezing and have asthma when they're teenagers. So it's possible that the virus, the SARS-CoV-2 COVID virus, has somehow triggered your asthma, but it doesn't mean you'll have it lifelong. It depends a little bit whether if you also have hay fever or eczema or food allergies, then you're more likely to have asthma ongoing. And asthma can start, never mind the pandemic, asthma can start in some people at any age. It's not something everybody's always had since early childhood. The other parts of the question were?
They were about when I turn 18, will I be sent to a long COVID clinic?
Yeah.
Has COVID weakened my immune system?
Okay. I don't think there's any compelling evidence in adults or children that the COVID virus does cause what we call immune deficiency or weakens the immune system. All illnesses, all infections make us a bit more vulnerable to other infections, whether it's the common cold or almost anything. All of these viruses, flu, can knock us for 6 and make us a bit more vulnerable. Ros was keen that we emphasize that you don't have to wait until you're 18 to get access to long COVID clinic. There are 12 long COVID hubs for young people around England. And back to the earlier question, to get referred, obviously you need to go and see your GP or go with your parents if you're a young teenager to see your GP, and they can refer you to a pediatrician or to a long COVID clinic. I know from talking to them that some of them are awash with referrals, but others aren't seeing very many, and it would depend what part of the country you're in. But you don't need to wait until you're 18. If you were seen in one of those clinics and then turned 18, it would be a personal decision, but they might want to be offered to keep seeing you, or they might say, we need to pass you over now to an adult health service. But you don't need to wait till you're 18 to be seen.
Here's a question that's either Emma or Ros, would you like to answer? So what is the best way to share ideas about the CLoCK study with friends and family? I don't know, who'd like to take that one?
I can share what the PPI group, we've asked questions about how young people think everything's best shared. And I think the answer is it depends on what platforms you use mostly. So sometimes that will depend on your age as well. But if you're sharing it amongst friends and family, any of the information that is recorded, like the webinar we're doing here, any of the things that are publicly available, you know, send them in a way that you know your family and friends are going to listen to them and engage with them. So there's no hard and fast rule, but if it fits, then send it.
I also noticed in the chat, someone commented saying that we can disseminate our information to children and young people via Newsround and Snapchat. So we will look into that as well. Thank you. So there are a couple questions about the certificates, and I can answer them. So the certificates are on the CLoCK thank you page and they can be downloaded. The link is in the survey when they go out, and we will also put it in a message when we send everyone a link to the recording of this meeting. So we'll make sure to disseminate the links for you to be able to download the certificates later. I'm just aware of the time because I believe that the seminar finishes at 6 o'clock. So maybe we just have one more question. Let me see. Oh, here's one. Can long COVID ever be lifelong or affect adults who caught COVID as a child? Yeah, Terence, would you like to take that one?
Well, Ros might want to comment on this one as well. I suppose the quick answer is we don't know the power of the research and why we need your help. And Ros emphasized why we need you all to hang in with us for at least the 2 years of this study, and maybe we'll extend it further, is nobody knows the answer to that question yet. I heard a group of heart specialists talking about one of the rare problems with the COVID virus infection is that in some young people it can infect the heart and cause inflammation of the heart. And they made the point, again, as I was saying at the top of the program, this is a new disease, a new virus, and they were saying we'll need to follow these young people up for at least 20 years because we can't look it up in a textbook. It's not been done before. So we want to try and answer that very question. I know from other viruses before we had COVID, if you think there's a virus, hepatitis is a virus that inflames the liver, and glandular fever is a common viral sore throat in teenagers. They can affect people for very long times, but not usually lifelong. But we're in a new situation. That's why we need you to help us and stick with us. Ros, did you want to add anything to that about ongoing symptoms?
Nothing to add. There are quite a lot of questions in the chat and there are 44 open, so I'm trying my best to answer them as quickly as we can. But just to say, we will send out the slides afterwards, so you will be able to see the schedule and when you'll be expecting your next questionnaire. And the idea of sharing the slides and doing school assemblies to help, and that would be really, really great in order to share knowledge. So thank you for those great ideas.
So just a couple of questions in the chat as well about looking at ethnicity. We definitely will be doing that, and that's high on our agenda. Someone was asking about vaccinations, and since completing the survey, I've been vaccinated. Could that impact me being chosen for or not for future studies? I think just don't worry about it. When the questionnaires come to you and we ask about your vaccination status, just tick the appropriate box and we'll take that into account in future study work that we're doing. So that is absolutely fine. So I think we can probably wrap up now. Would anybody like to say any closing words? Thank you very much for all of you coming. I saw at one point there were over 220 people here. We massively appreciate that. Ros, do you want to say something?
We're very keen to protect people's identity. So we maybe will work with Michael about sending out sort of a newsletter with the questions and answers in them. Michael, what do you think?
Yeah, so what I would suggest is that we'll have a copy of the questions here and we will try our best to answer them in the next newsletter that goes out. And I'll send a link out to that when we send out everything else.
Thank you very much, Michael. And yes, thank you everyone for coming. It's been amazing. And yeah, just continue filling in your surveys. And if you have any questions, please do drop Michael an email because now you'll know who Michael is. Yeah, thank you very much, everybody. Bye-bye.
Thanks, Nihal. Thank you, everybody.
Yeah.
Thank
Bye-bye.
you.
Bye.